Interest of providing key patient guidance, what would you tell a patient relative to finding the best facility to be treated in and the best doctor to get radiation therapy?
Many times not the best doctor is a doctor you like, that you can trust him, because I think the first thing a patient must have is to know, to understand the disease and to trust the doctor. No? Many patients come to me because they have a lot of search in internet. Sometimes they have gone to 2-3 urologists, also radiation, and at the end, what they want is just an opinion. No, if I was your father, if I was your husband, what would you recommend me? So it's important you can trust the doctor. No, that the doctor explains you clearly the different options. And of course, sometimes you have to counsel him the opposite of what he wants to do. Sometimes some patients, especially with prostate relapses, come to me, sometimes an old patient, and I want bracket. No, it's not possible because your PSA is too high, you have a lot of secondary effects for previous treatments, no? So many times your counsel is not what you are specialized in, no? Or for example, if a patient has a big prostate and has problem to urinate, probably I would say, no, please, it's better for you to receive surgery. So, of course, the patient must know all the options, but I think he must trust the physician. And the physician must be honest and give him all the options if they are equal. If not, counsel him the best one.
I think the whole thing is what you're saying is that the patient needs to be informed and they need to be able to communicate with the doctor who's willing to listen to them and be able to counsel them, in a way that maybe they didn't want, but give them the best possible answers they need to have.
Yes. Sometimes it's not easy because you have a patient if each 20 minutes or half an hour, and of course if you have to look up to all the reports and talk to him, and he of course must have time also to explain his doubts, no? But at the end you must get an equilibrium between all these things, and I think the patient must be satisfied and convinced with the final decision. Of course, always I advise him the best treatment, but if you change your opinion, of course you can change. You are free. But sometimes they have even an excess of information.
True.
And then so sometimes the patients come, do what you want, and that's all. Sometimes when they have so many information, it's difficult because for many times for a doctor specialized in prostate, it's difficult to say the best treatment. So some patients feel that they are very loose, that they don't know what to do, and that is really, they feel very anxious.